experts in business and health, featuring your host, Dr. Alex Rosa. Let's get into today's episode. Welcome to In Your Business with Dr. Alex, where we get all up in your business and your health. Enjoy live interviews and solo sessions with experts in business and health, featuring your host, Dr. Alex Rosa. Let's get into today's episode.
Hey, welcome to today's episode. We're going to be talking about hormones, heart disease, high cholesterol, and medications. And we're going to get all up in your business and get to some truth and some real talk about these different issues and how they might be affecting you and what your options are when it comes to this, because you definitely got options. So if this is the first time you're watching, welcome. My name is Dr. Alex Rosa. I'm the founder and creator of Spice and the 90-Day Metabolic Makeover, and I'm an expert in all things intermittent fasting and metabolic health. I teach women 40 plus how to lose fat, balance hormones, and get it on with the lights on. And today I saw a question floating around on social media, and I thought I would make a video about it for today because I know this is a topic that affects a lot of women. And if you're in like the 35 and up, your hormones are starting to change, levels are starting to kind of go up and down, and your body's changing. And there's a lot of cascading things that happen once our hormones start to change, and it can be really confusing. And a lot of traditional healthcare, a lot of traditional medicine will just want to throw pills, drugs at you and not really get to the root cause of what's going on, or even take the time to explain how these things are related and what to expect and what you can do about it, how you can be proactive, how you can prevent, how you can mitigate, how you can manage, how you can reverse many of these changes that occur with our hormonal changes. So how does the body change? How are hormones influencing heart disease? So let's think about what heart disease is. It's also coronary artery disease, which is inflammation, it's blockages, it's that high cholesterol, it's the stiffening of your arteries, that's of your vessels. That's all what coronary artery disease is. And so hormones, if we're thinking about women and our hormones, our estrogen levels as we're getting older are starting to decrease, particularly the estrogen levels. And so estrogen is actually a hormone that helps to eliminate LDL cholesterol from our body. So what types of cholesterol are there? There's LDL and there's HDL. So H is the happy, that's how I think about it. H is for happy, HDL, high density. Okay, that's the good cholesterol, because actually the membranes of all of our cells in our body need cholesterol. They're made of a fatty, waxy substance. We need cholesterol to live, okay? And the HDL is a good type of cholesterol that we want. However, there's also LDL, which is low density lipoprotein. That's the one we don't want. L is what we don't want. Okay, L is for loser. We don't want none of that stuff. So what happens is when our estrogen is decreasing, it's not able to remove and eliminate that LDL. So we start to accumulate LDL, and that's what leads to heart disease, coronary artery disease. And actually, heart disease is the number one killer of women is heart disease, heart disease, stroke, heart attack. Those are all the major killers of women as they get up in age, as they are 35 and up, 40 and up, going through menopause, after menopause, because of these hormonal changes that lead to an accumulation of cholesterol. So we end up with high cholesterol as we age because of these hormonal imbalances. So if you were going to your doctor, you'd really want them to run cholesterol levels on you. They want to get some blood work to look at your cholesterol levels. There's a couple different cholesterol tests out there depending on what type of provider that you're going to. So you can get like a total cholesterol, you can get an advanced lipid profile. So lipids are just fats. It's another way of looking at the cholesterol in your body. You can look at your triglyceride levels. There's something called an ApoB. That's another lipid profile that we can look at. So these are all different types of tests. And I don't want to go into exact levels. Like somebody might ask, I could see a question coming through of like, well, my cholesterol level is this. What does it mean? I've made a couple of videos about lab results and my beef with lab results and interpreting lab results in traditional healthcare, in the traditional healthcare settings. And actually, as a provider working at different hospitals, you know, every hospital has its own laboratory values that it goes by, what it considers high, what it considers low, and every physician is going to look at things differently. So I don't want to give you a range or a number. You can go onto Google if you want to and look at the different ranges, but until you actually work with one provider and know what their ranges are, that's how they're going to guide your treatment. So for me in my practice, you know, I've ran cholesterol levels on people and I've actually found high cholesterol. Women didn't even know that they had high cholesterol. They were like, oh, you know, I'm pretty, you know, I'm not very overweight. I'm pretty active. I got this, I got this. But lo and behold, we run their lab work and cholesterol is high, a little too high for me. And so that's where we can start tailoring some interventions to reverse that and bring that back down to a normal range, to an optimal range. That's what we want. And so that's something that you can think about and talk to your healthcare provider about. And if you start asking them these questions about your liver and your cholesterol, and they don't want to run any tests for you, I actually got a little bit ahead of myself just there because I said liver and I haven't got to the liver part yet. But if you're asking them to run these cholesterol tests and they're not wanting to, or they're saying, oh, you don't need to know that, that's, you know, that's not needed, blah, blah, blah. No, you go find somebody else that's going to listen to you, that's going to have a conversation and be open to what you want to know about your body. Okay, you deserve that conversation about your body. Okay, so cholesterol, it's absolutely vital to know your cholesterol levels because, again, high cholesterol leads to coronary artery disease. It leads to heart attacks, strokes, death. High cholesterol will kill you. It's highly inflammatory. It's highly sticky. It causes constriction and narrowing of the blood vessels. And if blood can't get to parts of your body, those parts of your body cannot function appropriately and they will start to shut down. You want optimal blood flow to every part of your body, honey. So we need to keep our arteries and our veins nice and clear and open, nice and stretchy, and able to pump that blood as good as it possibly can for as long as it possibly can. Okay. So now let's get into medications. So typically the medications that are going to be prescribed for high cholesterol, we'll talk about high cholesterol first, are called statins. Now, statins are not my favorite. They have a lot of side effects. And in particular, one of the most common ones that people will complain of, and if you've been on a statin, and if this is you, feel free to message below. And if you've experienced this, is muscle cramps, particularly in the lower legs, in your calves, are muscle cramps, or even all over your body. You can get severe muscle cramps, but usually it's the legs. Some other ones are increased blood sugar, it's hepatotoxic, so it's toxic to your liver, which does not make sense to me why we would put people on statins that can affect your liver enzymes, your liver function, okay, when your liver helps to break down your cholesterol in your body. Your liver plays such an important role in cholesterol in your body. So why are we giving you a medication that's going to potentially harm your liver? I don't understand that. So when you're on statins, we are running specific liver LFTs, liver function tests, looking at your ALT, your AST to make sure that your liver is still working and that we haven't killed your liver. Okay. In all honesty, in all reality, that's what it is. So we're running this lab work because we've started you on this medication for your cholesterol, but now we're damaging the fuck out of your liver, which is not going to help you process, metabolize your cholesterol. It's not even going to help you with your medications to process and detoxify, metabolize your medications. So it just kills me that we're doing this stuff to people. So statins are not always necessary, and there are risks. Another risk of statins is called rhabdomyolysis, and this is where your body literally is breaking down skeletal muscle and it's going into your bloodstream. And we can pick this up on lab work, and you'll start to feel very tired. You'll start to not feel very well, and it's rhabdomyolysis. Your body's breaking down skeletal muscle. Does this sound okay to anybody, really, to be on a medication that can do this to you? So that's the medications for cholesterol. Now let's look at medications for hormones. So yesterday I talked about HRT. There's risk versus benefit, right, with HRT. And again, as I said yesterday, I'm not for or against hormone replacement therapy, whether you're doing it systemically, right, through your entire body, or you're doing it just vaginally. I am not opposed to any of that. It's your body, it's your choice. You go to your provider and you talk about the risks and benefits. And again, if you attempt to have this conversation with your provider and they don't want to listen to you, or they're talking down to you, if they're dismissing you, or saying it's not appropriate, or if they're pushing it on you and you are not interested in it, then please fire their ass and go work with somebody else. Go find another provider that will listen to you. Because I will go off on how women in healthcare, women as patients, are misrepresented, women as a whole. We're misrepresented when it comes to healthcare. Okay. We are misdiagnosed. We are over medicated. We are not listened to at all. Okay. So if you find yourself in that position with a provider, go find somebody else, honey. There are telehealth options. There are all kinds of providers out there. You can find somebody who will have an open and honest conversation with you, lay out all of your options so that you can make the best decision for you. Okay, because HRT can help to increase the estrogen, balance out progesterone, can help you to feel better overall. There's lots and lots of women who choose to do HRT. I do not prescribe HRT. I don't prescribe any medications. What I do is consult with you and advise you on, is this going to be a good decision for you? What do you think about it? Oh, now you're on it. This is what we need to plan for. This is what we need to look out for. This is what we need to tweak. Okay, I don't prescribe any medications. I'm not against medications at all. There's a time and a place for medications, but this is absolutely an area where you can be proactive, where you can be informed and be empowered about your body. It's your choice. It's your body. So what are you going to do? What are your options? Having a provider that will talk with you about your options and be real and honest about you and your beliefs and what you want for yourself and what your goals for your health are. That's the most important topic conversation that you need to be having around hormone replacement therapy. Okay. But again, there are risks versus benefits. And again, the number one killer of women, it's not hormone replacement therapy. Okay. It's heart disease. It's coronary artery disease. It's stroke. It's a heart attack. How many of y'all have friends who are just dropping dead from a heart attack? Like just yesterday, I got an email about how our local NABO chapter, the president or one of the higher ups in the organization just died, heart attack, sudden, in her 50s, died. You never know. It is the number one killer of women. We got to stop playing with our health, with our hearts. We absolutely have to stop doing it. To think we have so many chances, girl, you ain't a cat. You don't got 9 lives. You have 1. Make the most of your time, of your health. Be knowledgeable about your body. Be empowered to make informed decisions for yourself. So again, HRT, I'm not for or against it, but the benefits, if you want that, there are benefits out there. Again, risk versus risk versus benefits when it comes to those types of medications. So it can absolutely help, and it can help to decrease your cholesterol, help to bring that back into balance, but it's not the cure for high cholesterol. HRT is not going to cure your high cholesterol, because a lot of high cholesterol is related to lifestyle. Okay, it's related to extra weight. And unfortunately, also, as we start to age, we become more sedentary, right? We're not moving as much as we used to. And that's one thing that I'm always, getting on my clients about, is being active every single day. Being active every single day. We can't just sit around and waste away our bodies and be living in a chair. Chairs. Oh my gosh, there was a study that talked about chairs and sitting and how it's like the new heart attack or something. It came out not too long ago. We have to get moving. Aim for at least 8,000 steps a day. Get your ass up and move. Just walking is plenty to get you up and moving. If you're not used to doing anything at all, shoot for 8,000 steps every single day. Get yourself a tracker. Get something where you can monitor how much you're actually moving. Like, what is the reality of your situation? Because we always think we're doing more than we're actually doing. What is the reality of your situation? Track it, measure it. Know where you start and improve from there. So just that simple act right there can decrease your risk factors just right there, because you're being more active. You're being more active than the majority of people who are dealing with extra weight, who are dealing with these high cholesterol levels, with this heart disease that is creeping up and creeping up. Heart disease is like compounding interest, but not in a good way, right? Because you can eat one bad thing. You can eat one hamburger. You could eat one Snickers bar. You could drink one milkshake. That's not going to do anything. That's not going to kill you. But what will kill you is 10 years of cheeseburgers, 10 years of milkshakes, 10 years of hot dogs, 10 years of this and that. That is what will kill you. And that's what accumulates over time. That is what compounds over time. That's just what adds to your high cholesterol getting even higher once you do reach menopause, and once those hormones do start to change. You're not in the best shape going into it. But that doesn't mean that there's no hope, that we can't fix that we can't alter the direction, right? Because I'm always talking about defy the odds, break the cycle. It's not too late. You absolutely can. At any age, you can make improvements to your health, to be proactive. And so this video is for both. Like, if you're younger, if you're on that like lower 35 range and you're watching this, take heed, listen to the words that I'm saying, because you can absolutely make changes now so that this is not an issue for you as you get older. And if you're already gone through menopause, or if you're going through menopause, it's still not too late. Know the reality of your situation. Be empowered, get the knowledge, have these cholesterol levels ran, have conversations with your healthcare providers. Don't just be in the dark. Don't be ignorant about your health. Okay? Know what is going on with your body. And then by working with somebody like me or somebody else, another healthcare provider, talk about your options. What direction do you want to go in? What goals do you have? And again, if you got a provider that's not going to listen to you about any of this, they're not the one for you. Because this, again, is the huge gap. And where we are failing people in medicine today is we're not listening to them. We're wanting to throw medications and throw tests at people, and then just giving them pamphlets to go home with, and not figuring out and not working with them. Is this going to fit into your real life? Can you do this on your own? Is this sustainable for you? Is this a lifestyle for you? Or is this just a quick fix, a fucking Band-Aid? What is this? You deserve more than a Band-Aid, honey. You absolutely do. So how can we take this knowledge, this information, and create a plan that you can have a lifestyle around, so that you can defy the odds, so that you can break the cycle, so that you can be around, right? Just like I made that video the other day. What is it worth to you to have one more hour, one more day, one more week, one more month, one more year, 5 years, 10 years? Just think about somebody that you lost in your life that you loved. What would it be worth to you to have one more day, one more week, one more hour with them? What do you think they would give to have had one more hour, one more day, one more week, one more month with you? What advice would they give you? What would they tell you if they knew that you were going through this right now? They would say, stop fucking around, get your shit together, and take care of your health. I have seen it over the 2 decades that I have worked in healthcare. I have seen it all the time. Thousands and thousands of patients who go through this dialogue externally, internally, they are talking it out. It always happens. You've probably experienced this with people in your life that have been on their deathbed, have taken their last breaths. You have experienced this with them. So why are you not taking your health seriously? Why are you not doing the things, being proactive about your health? Stop playing with your health. This hormones and heart disease and high cholesterol, medications, these are all things that you can be informed and empowered about to make better decisions for your health in the current, right now, and in the future. And that is my goal for making these videos, to educate and empower you so that you can make the decisions about your health that are in your best interest, to meet your future goals, to get you to where you want to go, to be around for your family, for yourself, for your business, for your career, for your husband, for your wife, for whoever. That's what I want for you. But it don't matter if I want it unless you want it. Does not matter if I want it. It's if you want it. If you take this information that I share with you and you implement it, you take action on it. That is what is more important to me. So that is today's, look at me, look at that. Because I get passionate about that 100% because I care. I care so much. So, all right, guys, if you have any questions, drop them in the chat. If you want to be a little bit more discreet, send me a message. Be like, hey, Dr. Alex, I saw that video you made about hormones, heart disease, high cholesterol, medications. I think this is what I have going on. Let's have a conversation about it. Amazing. That's all it takes. That's all it takes. I'll be more than happy to talk with you and see how we can create a program specifically for you to meet your needs, where you're at right now in your life and where you want to go. Absolutely. I would be more than happy to. So share this with a friend if you found it impactful, if you found it helpful. If I share some good info, let me know. Give me some feedback. And if you want more videos like this on these types of topics, let me know too. Or if you want me to talk about something else, let me know. So, all right, that is all I have for today. And like I always say, for balanced life, just add spice. I'll catch you in the next video.